More than 100 employees of a popular ski resort in Colorado have tested positive for COVID-19 after they contracted the illness by holding social gatherings outside of the workplace, though the actual number of infections is thought to be far higher. The Colorado Department of Public Health and Environment has reported 109 cases of the coronavirus at the Winter Park Resort. The outbreak was first declared on January 23 and accounts for more than 6% of the 1,700 employees at this. Grand County.The did not report the positive cases to the state until this week. The Grand County.The and the Winter Park Resort issued a joint statement that said the cases have not been traced to interactions with visitors. The number of infections is thought to be far higher because many people have not been tested. Studies suggest people can be infected with the virus without feeling sick. A spokesperson for Winter Park Resort told DailyMail.com that the complex took necessary precautions to mitigate the spread of the virus before it reopened to the public on December. Jen Miller said that the resort implemented rules requiring masks and social distancing throughout. In addition, the resort put in place increased sanitation procedures and added staff to remind visitors about masking requirements. There is no indoor dining available at the resort as visitors are only permitted to do grab-and-go food shopping. Miller. WPR has worked closely and been transparent with state and local public health authorities since the onset of the pandemic and in recent weeks to navigate these dynamic circumstances, Miller told DailyMail.com. WPR has an on-site testing site that they have managed since December and has consistently utilized GCPH testing sites as throughout the past few months. WPR has implemented robust contact tracing among employees, which has helped. Grand County Public Health and a CDPHE contact tracing support team has been enlisted as needed during this outbreak. WPR has also enlisted a CDPHE epidemiology/hygiene consult to further investigate changes that could be made that could suppress COVID activity among it. For most people, the new coronavirus causes mild or moderate symptoms, such as fever and cough that clear up in 2 to 3. For some, especially older adults and people with existing health problems, it can cause more severe illness, including pneumonia and death. Other popular ski destinations in Colorado reported outbreaks, though far smaller. Breckenridge reported 12 active coronavirus outbreaks totaling 26 cases, while Keystone has 4 outbreaks with 10 positive cases. State public health officials define an outbreak as 2 or more cases of COVID-19 that were contracted at the same time. An outbreak is considered resolved only after 28 days have passed without any new infection. According to the latest data, there are 430 patients currently hospitalized with COVID-19 in Colorado as of Friday. State public health officials said that the moving average positivity rate has declined 95%. The World Health Organization recommends that positivity rate be kept at or below 5% in order to contain the virus. As of Friday, nearly 609,000 Colorado residents have received at least 1 dose of the COVID-19 vaccine. In addition, 271,104 have been inoculated with 2 doses. The state is also reporting good news as hospitalization rates decline. The latest figures indicate that 430 people are currently in hospitals due to confirmed cases of COVID-19. Another 40 patients are suspected of carrying the virus. On Friday, the state reported 24 new hospital admissions, down from 61 the previous. The 7-day moving average of new hospitalizations fell to 59 this past week, down from 64. Of all hospital beds available in the state, just 5% are occupied by either confirmed or suspected cases of COVID-19. State officials are also reporting just 2% of medical facilities that say they face ICU bed shortages.